I believe this message, this voice, this image finds you well. And if you're not well, we believe God is taking care of you. I greet you all in the name of our Lord Jesus Christ. I want to appreciate you for having chose Church of Uganda Family TV from wherever you're watching from. Thank you so much for watching us from morning up to this time. We cannot take this for granted. We love you, we celebrate you, and we are really proud of you. So here we are with the Family Hour. Family Hour is a program that empowers you one episode at a time, and you shouldn't miss any of our episodes, segmented episodes that are thematic. For example, on Monday, like yesterday, where we talk about education and career, and Tuesday is dedicated to family health. Wednesday is dedicated to family finances and wealth, while on Thursday we are discussing leadership and governance. Now Friday is where we have parenting, now that our children are coming back home. Some are already home, some will be home by end of this week or even next week. Yeah, we are ready to receive them, but it is very important to know what to do while you are with them. So you shouldn't miss any of these episodes, empowering you one episode at a time. Now in this particular one, because we are discussing family health, it is important that we also think about those people who are going through challenges and they need palliative care, because from our earlier discussions you realize that we all need palliative care. You and I need palliative care. You might not need palliative care now, but what will happen tomorrow? You will need palliative care at one point. So that is why it is important to understand palliative care, and we are grateful to the Palliative Care Association of Uganda for having given us all this time to take us through episodes and detailed discussions on palliative care. And today we are privileged to now have the top man himself. He's seated with us right here, and we are privileged to have you, Mr. Mark Mwesiga. It is a pleasure having you this evening.
Thank you so much, and it's good to be here, and good evening viewers, and I look forward to a good program.
Surely. Now, Mark is the Executive Director of Palliative Care Association of Uganda, and today we are discussing compassionate care in long-term illnesses. Of course, later on we shall join Rose Kiwanuka Musoke, who will take us through the journey of palliative care in Uganda. But for now, let us first of all focus on what palliative care does and how they do it. Mark, we are discussing palliative care. Of course, we've talked about palliative care, and we've also heard about Palliative Care Association of Uganda. But we have people who really don't know what Palliative Care Association of Uganda is and what they do. So I think we pick it up from there.
Yeah, thank you so much. And like I said, it's good to be here and to be speaking on Family TV. This is my first time to be here. And I thank the management for considering to invite us as the Palliative Care Association of Uganda to speak to the community about what palliative care is and what we do. Yeah. So the Palliative Care Association of Uganda is a non-government organization. If we can start from there. It's a non-government organization that is an umbrella organization for other organizations that are doing what we have been talking about for the last Tuesdays, that are offering palliative care, which is care for people who have been diagnosed with life-limiting illnesses, and care not only for patients, but also for the family or the caregivers. Now, the palliative care providers, they fall into two categories who are the members of the association. Okay. We have organizations. Most of these are hospices and hospitals which have a home care program because, as we have been discussing, you also find out that the majority of the patients that we see, especially those who have been discharged from hospital, go home. And so a home care is very important. So we have 28 organizations. These are hospices and hospitals, which are our members.
What is the difference between hospices and hospitals?
Yeah, so the hospice, you can say it's a program in a sense that it is a smaller component of what palliative care journey is. At a point when somebody is discharged from hospital, and not discharged to say they are cured, they are well, they are going home to be well. But in this case, the hospital has done the treatment and they have reached a point where they now need to manage this person in the transition, in end of life. So the hospice program, which is part of the long journey of palliative care that would have started at the point of diagnosis, now the hospice care or program would start from there. Initially, people would come into a home. Instead of going to their homes, they come into a home. We still have that happen. In the outside countries, we have people check in. But in our setting as the country, we still really pride, and which is good that people can go home and maybe spend the last days with their loved ones. So that's what I can say about the difference there. But we can explain more. Now, I was still telling you and telling people about the work of PCAU and what you asked me what it entails. And I told you it's an NGO composed of organizations which offer the palliative care that you're talking about, and hospice, and also individuals. Now, the individuals are over 1,400. And the association is open to membership. It's not limited to people, say, only health workers, much as you find that the majority are health workers. But like you've just said in the introduction, because we have heard that palliative care is everybody's business, as you transition into this life, you either have somebody who is diagnosed with a life-limiting illness, or you yourself in future, because I think it was today I was attending a memorial service and the priest said that one time we'll all face this, and this is a reality. So our membership is open. We have the palliative care, people compose the palliative care team, the health workers, the spiritual leaders, the lawyers, the social workers, the allied health professionals, the community members, the caregivers themselves. So that is what I can summarize as what is Palliative Care Association of Uganda, who is a member. Our offices are in Chitende on Entebbe Road. That's our home where we are. We also have sub-regions where we have committees, like we have at the National Secretariat. Now we are in different. When you look at the map of Uganda, in every district, apart from at least 40 districts, in 107 of the districts in Uganda, we have at least a member of PCAU. We have people there who have registered with us, and which is good to talk about.
So we look at places like Chitovu Mobile. They have what they call safe places. We look at places like Kawempe, home care services, places like Ginger Hospice. Where do these ones fall?
So the three that you have mentioned are all members of the Palliative Care Association of Uganda. And
so what they do is to offer palliative care?
Yes, what they do is to offer palliative care to the communities where they are. Rays of Hope Hospice Ginger now is a hospice facility that complements what the hospitals do, because like I shared, the palliative care program has a component of going to the community and to the home. But our healthcare system in Uganda still, for example, the public healthcare system, the government health structure, is not yet going to the home. When you are sick, you come to the hospital. Now, the difference is that the hospice program, like Rays of Hope Hospice, Ginger, Kitovu Mobile, you spoke about, Kawempe Home Care. When you go up in West Line in Arua, you find New Life Hospice Arua. When you come to Ngora area, you find Hospice Ngora. Some of them are not very strong and vibrant, but the difference is that they will go home. And now, when they are doing the service, our role as the National Secretariat or the association is to continue supporting them, continue advocating that they can do this work better, continue supporting in a sense that whatever they need at the grassroots. For example, we have been appealing to the government to make sure that we have a national palliative care policy. We have been talking about a national communication strategy for palliative care. We've been talking about budgeting for palliative care. So for us at this level, we continuously to be the voice of our members who are at the grassroots. And it's not to say that they are only up country or that they are down there, but even here when you come to the city, like Impom Care is in the city, but you also have the Mulago Makerere Palliative Care Unit. You'll find they are in Chirudu, they are in Kawempe, they are even reaching communities which are around. Hospice Africa Uganda, which is the pioneer hospice organization in the country, established in 1993, is in Makindi, but they also have a satellite facility in Hoima and also in Mbarara. So we work towards coordinating the civil society efforts in addressing, but also integrating palliative care within the national healthcare system.
Okay. Yeah. Now we understand Palliative Care Association of Uganda at a broader image. So getting back to our topic today, we are discussing compassionate care in long-term illnesses. I think we start with the word compassionate. What does the word compassionate mean? And when we attach the care on it, how does it come out to now fall into palliative care?
Thank you so much, Mukalazi. It's a very good question. And whenever we see the word compassionate, I think the majority of the people who are watching us or viewing us, wherever they are, it kind of sounds like a church or a religious, spiritual thing. In the recent 5 years, we are seeing compassionate care or being compassionate permeate the healthcare system, and it's a new notion of ensuring that the quality of the care that is being offered is embedded and it is improved. But I can break it down. When you read about what compassion means, it comes from a Latin word, but for the benefit of the viewers, it is to see a problem or to identify with somebody who has a challenge, and not only to recognize that there is a challenge here, but to put yourself in the position of somebody who has this challenge, and then you take a step and act or work towards addressing this challenge. In a nutshell, in simple ways, you are being compassionate. And we live in a world today that is really, really, I can say, tough. We are continuously seeing ourselves being isolated, suffering in our own ways. I read something on social media last week that everybody has a hidden part of pain that they have within themselves, that they know themselves and they are not sharing with anybody else, and that is increasing. We are in a world that even you find that the neighbors, much as they may have somebody who's been sick for long, we are not sharing. We don't know about them. We are in a world where everybody is competing and trying to be well, but where we see a gap between those who have and those who don't have kind of increasing. So compassionate care comes in the realization of our humanity, that we are all human, that we all deserve to be treated and to be well, that we need to express kindness to one another, that we don't lose the ability to know that what we need, somebody else needs. And there's a time we had a training, and one of the people in the training said, behind every smiling face, there is a sad story. And sometimes we look at ourselves, the selfish nature that is permeating society is that we think we deserve more, or we are the ones who are really, really bad off. So in long-term care, compassion is important, and it is important that we know that other people are facing this issue. We come in to do what we are supposed to do to address that issue.
Okay, and now we get, because we really want to understand all this and link it up to palliative care. Now we look at long-term illnesses. How are these ones categorized? What are some of these long-term illnesses that really require the palliative care or the compassionate care that we are talking about?
So that's a very good question. Thank you, Mukalazi. And everybody viewing us will answer this question in their own way. Because sure. I know families have people who have been unwell for some time. And it is important for us to say, list the conditions or sicknesses that can have people be unwell for some time. But the majority of the conditions that we see in palliative care are lifestyle diseases or what we can call non-communicable diseases. Now we have been talking about the conference, the 4th Uganda Cancer Conference. And some people tend to say cancer is like equated to palliative care, but their lifestyle or non-communicable diseases are not necessarily to the fact that somebody gets these illnesses when they are old, but we also talk about some of the illnesses, or they could be some people, for example, children who are born with sickle cell, they have pain crisis and they have to receive this care. Talk about people who have high blood pressure, people who have diabetes, people who have cardiovascular or heart diseases. Now the cancer that we are talking about. Now palliative care extends to some of the conditions that come to the older persons. As people age and grow, then they are susceptible to a number of illnesses. Now, any family in Uganda will tell you how long they have had this person who has been unwell and what challenges they face. The palliative care approach is to look at the person who is facing this illness now, which has been diagnosed in hospital. Some of them being treated for cure. Yes, they cure, but some of them going to live with this for long. And now, anybody who has been in that scenario at the community level, when we say what condition, what do people face right there in the family, they will know. So the palliative care approach and the compassionate care that we're talking about comes into play to the extent that this is looking at a person as a whole, as one who has the physical pain, as the one who has the spiritual pain, or questions about God, why me, as one who has the psychosocial pain, because they are isolated, they are no longer able to be in employment, to do things that they are supposed to do, as they should do them, as one who has now that psychosocial need, something to do with the mind, because we are also looking at mental health and things. When somebody is really, really challenged and stressed up, it comes into that need of needing to be counseled, to calm down, to reduce the anxiety. And the palliative care team, which is composed of different multidisciplinary group of professionals, comes into a home to address these needs in such a holistic manner.
Okay. This is now very serious. And talking about Palliative Care Association of Uganda, we were privileged to meet the first palliative care nurse in Uganda, and she has a story to tell on how palliative care came into Uganda, how it was introduced, but also how Palliative Care Association of Uganda was formed, and what families need to know when it comes to compassionate care. Now, we are going to watch this video, and after we shall come back. We are watching Miss Rose Kiwanuka Musoke, who is a palliative care specialist.
Family Hour, empowering families one episode at a time. Together, we build strong, healthy, and thriving families with our daily dose of inspiration and expert insights on topics that matter, like education and career growth.
Education deals with the minds of our younger children.
We want to see more model schools.
talking about compassionate care in long-term illness, and with us is one of those people we really need to listen to. Of course, we know that palliative care has been in Uganda for now 30 years, but we looked out for the people who can tell the 30 years journey of palliative care. Now with us is the one, Rose Kiwanuka Musoke, who is the founder of, actually was the first palliative care nurse in Uganda, and she's the founder of Palliative Care Association of Uganda. So she's going to take us through this journey and why it is important for you as a family to know about palliative care and why you actually need palliative care, because much as we are talking about palliative care, but it is important that you understand what palliative care and your role in palliative care, because if you do not know palliative care, then you will not appreciate it. Like someone asked us of recent that how comes we don't see the palliative care in our health centers. I think they were expecting someone to come and say, hey, I'm giving out palliative care, so who wants palliative care? Now, that is why you need to pay attention to palliative care and these sessions that we are talking about. But first thing first, you're most welcome to this show, The Family Hour.
Thank you very much, Adrian, for hosting me on this session. And I'm so happy to be talking about palliative care.
Okay.
I feel great talking about palliative care.
And I already see the enthusiasm. I see the passion when you talk about palliative care. So it is almost painted in your face.
Yes, I like palliative care and I like talking about it. And I would love palliative care to be available as air, because all of us at one time or the other will need palliative care. All of us, we have patients in our houses, in our community, who need palliative care. But unfortunately, we don't know what to do, where to go, and yet we have the people who have the knowledge within us.
Okay. Just to get back, we are talking about palliative care and palliative care. I know there are people who are just learning about palliative care now. Especially when we've embarked on this awareness campaign of creating awareness. Secondly, some other people have limited palliative care to only cancer. Why is it limited to only cancer? Is it that it's only cancer patients that need palliative care?
Okay, that's a very good question. I don't think palliative care is limited to cancer only, but I would say all the non-communicable diseases will require palliative care. Palliative care is for those with life-limiting illnesses, life-threatening illnesses, but you may find that in our life, we all need palliative care at one stage or the other. Maybe at this juncture, you'd ask, what is palliative care? Exactly. For the person who is listening to us. Palliative care, I'll put it in a layman's language, is a service that is given to a person as a whole. We look at somebody's physical well-being, psychological well-being, social well-being, and spiritual well-being, together with the community and the family. Because you will agree with me, when somebody in the family is sick, the entire family is sick. When somebody is groaning in pain, you cannot sleep. So everybody there needs to be comforted, needs to be supported, needs to be counseled, so that you go through the journey of the illness of this patient together. Okay. Yeah, that's what I would call palliative care.
Okay. Now we want to embark on the journey of palliative care in Uganda, and because we understand you are the first palliative care nurse in Uganda. Now that you are the first nurse, where did you get the training from? Was it really easy for you to embark on that?
Yes. My name is Rose Kiwanuka, as you've said. I started the journey of palliative care earlier on in 1994. That's when I joined palliative care. Dr. Anne Merriman, who is the founder of Hospice and Palliative Care in Uganda, came to Uganda in 1993 and started in Nsambya Hospital. I happened to be working in Nsambya Hospital. And you might ask me what motivated me to join palliative care. At that time, we did not understand exactly what palliative care was all about. When this lady came in and started seeing patients on the ward I was working on as a ward in charge, I remember the first day she came on the ward, she asked, "Do you have any patients in pain here?" I was like, "What do you mean?" Patients who are in this ward are accidents, those who have cancer, those who have HIV, people have pain here. And she was like, "Okay, let's go and see them." So we went to see them, and there was a particular patient who will never leave my mind. Her family had deserted her because she was smelling and she was in pain, a lot of pain. We had actually isolated that patient. I mean, moved her from the ward to the outside in a side room because of the pain she had. She was crying in pain, and other patients could not sleep. So when this lady came in, she talked to her, gave her a tablet to chew, and within 10 minutes, this lady could sit up and talk to us. I was like, this is magic. I just couldn't believe it. So I observed her do what she was doing. She gave her a tablet to put where the smell was coming from. And for me, I knew that tablet, they swallow it. But she said, "No, just apply it topically on top. It will work." The next day, there was no smell. The patient was smiling, and that struck me. And I was like, I think this is what I need to do. So then she continued coming on the ward. I gained the interest. I would escort her to see the patients. I would show her the patients who were in pain. And later on, she told me there was a training. She was actually the one conducting it. I did the training for 3 months. And whatever I learned, I really felt they were making me a real nurse, a complete nurse. What do I mean here? You care for the patient right from the time of diagnosis up to the time of discharge or death. And then even after death, you continue interacting with the family. That is what they call bereavement care, which I had not gotten in my nursing training. Okay. So that interested me to join palliative care. I trained on the job initially, and later on, I was sent to Oxford to continue training in palliative care. And when I came back, I was tasked to train my fellow nurses. And it was quite interesting to see that it was mainly the nurses who came on board to train in palliative care. And maybe I would relate it to their work, because you know, when you get in the hospital, definitely you will see that nurses are the majority in the healthcare system, but also they stay with the patient for a longer time than the doctor. So they face the pain of the patient. I hope you follow what I mean. Because the patient will continue calling, "Nurse, I'm in pain." And if you don't know what to do, it gives you pain yourself. And actually, that's why I joined palliative care, because I wanted to help that patient who was on the ward with me all the time. And because the doctors would come in, prescribe the medications, they leave you with the patient, and then they instruct you, give that medication, the pain control, the strongest pain control, 3 doses. Every after 8 hours, you give a dose. After 8 hours, you give a dose. You give only 3. After 3 doses, no more, because the patient will get addicted. But remember, if it is a cancer patient, the pain has not gone away. Yeah. The patient will continue calling for help. So what do you do as a nurse? You start avoiding the patient. And it haunts you if you are a good nurse. It haunts you to hear that a patient is calling you and you're not responding. Yet you fear to respond because you don't know what you will do for that patient. And that gives you pain. So really that was my turning point. And I joined palliative care in April 1994. And I've never turned back.
Okay. So what prompts you then to come up with an idea of the Palliative Care Association of Uganda, even when there were many people offering this service at a time?
Okay. Actually, this idea came up when I was still in hospice. We had trained a number of healthcare workers. We used to conduct courses for nurses and doctors all together, even social workers. Then later on, we thought of these people have been trained, but how do we follow up to see what they are doing? Then we devised means of calling them back so that we could kind of sit down, look at their successes and the challenges since they trained. So one time when we were in that session, people were like, but we need a fora where would be regularly doing this. And then we said, we need to have an association. People who have trained in palliative care should come regularly, and we meet, we talk about our successes, our challenges, and maybe even advocate for advancement of palliative care. And we said yes. So the word Palliative Care Association of Uganda was coined in 1994. Okay. And these were healthcare workers who would come together from the different hospitals and would meet quarterly. And I'm glad to say that it has continued up to now. Because right now I'm retired, but Palliative Care Association of Uganda is going strong, and the palliative care practitioners are really doing good work wherever they are in the communities, because we have a number of healthcare workers within their healthcare facilities. When you said that people go to health centers, hospitals, and they're looking for palliative care, the healthcare workers are there, request for palliative care, and you will get it. But you won't find somebody with a poster on the chest that here I am a palliative care nurse. No, we expect all healthcare workers to provide palliative care services because they are trained. We now have an advanced diploma in palliative care nursing. When they qualify, they go back in their health facilities to provide palliative care services. We have doctors, they train in palliative care. So palliative care services are there in the community, in the health facilities, and patients should receive this service. Yeah.
We see that today the numbers of patients with non-communicable diseases are increasing, and this is alarming. So according to you and your experience, do you think there is really enough awareness on palliative care, or there is a lot that needs to be done in order to create awareness so that people out there can really embrace palliative care?
A lot of awareness has been done. Advocacy has been done, but I want you to know that not everybody knows about palliative care. I'll use an example of my own community where I live. I've lived in this community for almost 30 years, and I thought people knew what palliative care is because I was living in this community. But unfortunately, I did not go around to talk about palliative care. Even my neighbors didn't know about palliative care. I would wake up very early in the morning, go to office, go to these big offices, talk to these big people, talk to parliamentarians, go to districts, talk to the DHOs about palliative care. But my own community didn't know palliative care until I retired recently. I started moving around. That's when people are getting to know about palliative care. And yet, the people who need palliative care are in our communities. They are there with their relatives. They are suffering with these people. Yet pain control is available. Medications are available. Our country, Ministry of Health, provides these medications free of charge, and patients should access them. But it's because there is knowledge deficit among our people. So we need to do a lot of advocacy, working together like this, working with the Family TV and other TVs and other medias is important to make sure that the information reach the people at the grassroots. Okay. Yeah.
So we're looking at now the families and the family members. What is their role in palliative care now that we know the role of the palliative care nurses? So what about the families? Because literally, especially for those people who are at home, it is the family members that spend much time with them. What is their role and what can they do?
I think the family members have a very big role to play, because remember, they are the people with the patient all the time. The patient, they need to have a positive attitude to care for this patient. But you know, when somebody is chronically ill, they lose it. Even if it were you, day in, day out, you're with this patient. The patient himself gets tired. And when they get tired, they become, I don't want to say troublesome, but they become complicated or difficult, as relatives say. And they need somebody to comfort them, to guide them, to show them what to do, to work with somebody so that they can help this patient who is sick in the house for a long time. Some of the patients are in their houses for months, for years. They never get out. The carers get burnt out. The patient also gets tired. Therefore, we need to work together. They need to also to be trained on how to care for them, how to communicate with the patients so that they can help the patient, so that the patient can go comfortably and they themselves also can be at peace with their patient. Yep.
And on that very note, what do you think these family members and families can really do, especially when it comes, for example, we saw during lockdown, COVID-19 lockdown, very many of our families were stuck with situations that were beyond, and I think this is partly why there were escalating numbers of mental health, because people were traumatized. Yes. So is there anything they should know at this point that, for example, in such a situation pops in, you don't need to rush?
What I would say, the family needs to know whom to lean against. They need to know how to communicate with these people. But also, there are many healthcare workers in the community who have the knowledge in palliative care, leaning against those people so that they can support them to care for these patients. There are also trainings which are going on, but unfortunately people may not know. For example, the Institute of Hospice and Palliative Care in Makindye offers trainings for non-healthcare workers. These are family members. They teach you how to look after the patient, how to communicate with the patient, what to do when you get somebody who actually needs palliative care. So the family has a very big role to play. The issue of communication is very, very important, because at times we find that the family knows the problem, the patient knows the problem, but they cannot talk about it together because they are fearing to hurt each other. And yet when they are empowered, they can be able to talk about it comfortably and everybody will be at peace. So it is important that the family members are empowered on how to care for the patients in their own community. It is important that the relatives know where to seek support from when they need it. Okay. Yeah.
Now, you as a palliative care specialist and probably the pioneer of palliative care in Uganda, where would you want to see palliative care be in the next 5 or 10 or whatever years?
Where do I want to see palliative care? Yes. One, some of the things have been done, some of the things have not been done. I want to see palliative care strong in our healthcare system. Palliative care in all health training institutions. Currently, it is the nursing school and one that is Mulago School of Nursing that has the advanced diploma in palliative care nursing. I wish all the health institutions could have that course in their schools. That would be helpful, because we have many nurses qualifying with a bit of knowledge in palliative care. But if it is a standalone course, then we know that that person has trained in palliative care and can help the patients. Palliative care should be in all medical schools and all clinical officers' schools, which we call, they are clinical officers' school, or not medical assistant, the name changed. It is clinical officers. All clinical officers' schools should have palliative care, but also there should be kind of information even in schools. The schools should learn about palliative care, because we need to learn it right from childhood. Know how to handle our patients, because we have them, and these children are there in the community with their relatives sick, so they need to know what to do. Many times children are pushed away. When somebody is sick, maybe daddy is sick, they don't want them to know, but they're also suffering. They need to be helped, and it lingers in their mind when they're still young. Even when they grow with it. So it becomes a real challenge. That's why I'm saying palliative care should be everywhere, should be as available as air. Everybody needs it. Yeah.
Now, as we wind up this discussion, what would be your last remark on palliative care?
My last remark on palliative care is, let all of us embrace palliative care, because we need it. You don't know when actually you will need it. It could be your relative. It could be you yourself. And I'm not ashamed to tell you that I've been in palliative care services providing it, but I'm also a recipient of palliative care. So palliative care, everybody needs it. And I'm happy to say that there is a conference which is coming, which is organized by Uganda Cancer Institute together with the Palliative Care Association of Uganda, Ministry of Health involved, and it will be in Munyonyo from 14th up to the 15th. I would really encourage people to come. Let it be healthcare workers, non-healthcare workers, because palliative care is everybody's business, and we all need to be involved to be able to support each other, because believe me or not, dying is a must. There is nobody who will not die, but dying in pain is unacceptable. The pain I'm talking about, we've talked about it, physical, psychological, social, is unacceptable. We can support each other to get out of pain, and somebody dies comfortably, peacefully, in dignity. Thank you very much.
We are grateful. Thank you so much for this time. And like she has put it, everyone is a recipient to palliative care. Everyone needs palliative care. You and I are subjects of palliative care. We don't know when, but at least there will be a time when you need palliative care. That is why we cannot keep quiet about palliative care. Let us spread it. Let us spread the awareness. Let us let people know about palliative care. And when this information is dissolved in everyone's mind, then I think we shall appreciate it more and more. Thank you so much. The message was really, really very clear that you and I need palliative care. That is why we need to join hands. We need to join the struggle of creating awareness of palliative care, because we are all beneficiaries. We are all recipients of palliative care. The only difference is time, like Rose Kiwanuka has put it. But welcoming you back from the break, as we can put it. And if you're joining us right now, or you joined us when Rose was taking us through palliative care, we are with the executive director of PCAU, or Palliative Care Association of Uganda, and we are looking at compassionate care in long-term illnesses. Now, Mark, before the break, you had brought in something very, very important. But now we want to look at, because Rose cited out a few things that maybe things should be done in order to improve the palliative care. And now you, who is at the bottom, because you now receive all the pressure from all these member associations, member NGOs. So they all come up with challenges with what they go through and all that. Now, according to you as the executive director and Palliative Care Association of Uganda, what do you think needs to be done to improve, one, the awareness, but also to improve palliative care as a service offered to people?
Yeah, thank you so much, and thank you, Rose, for sharing with us passionately about palliative care as usual. We There are many things that can be done to improve the palliative care service in the country. When you come to the Secretariat on behalf of the Palliative Care Association of Uganda and Mukalas, we invite you and the rest of the people to come. We even have this on our website. We have a strategic plan which lays out areas that we think are very important for the country. And one of them is to make sure that health workers at whatever level, be it at the primary health care level up to the tertiary health care level, that there is training. And as Rose stressed about it to some extent, we need to make sure that we have more people trained and that they can provide the care. And we're not talking about nurses and doctors only, but also the allied health workers. We're also talking about social workers within the hospitals, the medical social workers. We're talking about lawyers, because when you talk about end-of-life care, as Rose was explaining, and dying not in pain and agony and suffering, that means some preparation. That means succession planning at home. That means will making. So we need lawyers on board. We need paralegals on board. We need social workers on board. But we also need spiritual leaders. We know that in our country, before they bury or they do anything concerning anything to do with the end of life, the spiritual leader is important. And the pain that is spiritual is big. So we need more training. And the Institute of Hospice and Palliative Care in Africa in Makinde is offering these courses, plus Mulago School of Nursing for nurses and the other institutions. But the appeal, the health workers and the community and you media people to come up and learn is one thing. The other important thing is research. We laid out a research agenda. We need to find information that informs decision making and put it in proper way. The other important thing are the key guiding frameworks and documents that I spoke about, the National Palliative Care Policy, for example, the national standards of what should be across the board. And this is why we have been appealing to the Ministry of Health. They have established a division for palliative care. Now we want and request them to move forward and make sure that the structures at the lower level are working and are strengthened. And also the governance of the hospices and standalone places that we talk about. But most importantly also are the resources, the monies. As the government talks about the healthcare budget, what amount is allocated to palliative care and home care services and reaching out to the community? What amount is, and you look at the ability that is within ourselves, the potential that we can all contribute, because not many people know about palliative care. But the amount of resources, like Family TV has done amazing. We are here, we are speaking about it, but not every TV, not every radio will take this message. And I can tell you, by us coming here, somebody in the community, somebody in the home will hear our service, will hear the voice. We have a toll-free line, by the way, and people can call in and ask questions, and it could be run on the screen, or I could share it at the end of the show and mention what it is. That people have information. I think that's one of the needs that we have. And then, if I could say lastly, but of course there are many things, the coordination and the working together. How do we make sure that everybody who can contribute, everybody who can offer the service joins the association? That when we are speaking, we speak as a big movement, we speak as a coordinated service, we speak together, and we all move ahead, because when people are together and are doing work together, they accomplish much. I think those are some of the things that I can really mention as what needs to be done.
Okay.
Thank you.
And that is very, very important. Now, you talked about people calling in, and I want us to share with them some of these numbers that they can call for inquiries. But before you give them the numbers, what should, which cases should now prompt people to call at the Secretariat and not visiting the various palliative care service providers?
Yeah, so thank you so much, Mukalas. I wanted to say that You know, we always encourage people, whoever has a health issue, please reach out to your nearest health facility. And some of the people sometimes say, I go there, they won't help me, there's no medicine. But you see, they will give you information on where to go next, other than remaining home or on assumptions and then being led astray, because the more you wait, the more the condition you have may require more attention other than when you could have gone early. So I encourage the community and people listening to us, if you have any sickness or you are unwell, please reach out to the nearest health facility. But in case you're listening into this program and you have somebody who has had a long-term illness or you feel they need to be referred, then we are okay. Or you feel that somebody has told you before that they are referred from hospital, they need to access oral liquid morphine or medicine to control their pain, but they have had a lot of challenges to access that because in the community there is no accredited health facility, then I can read out the toll-free line for PCAU. And I had also requested that perhaps the TV will share it. And this is 0800 399 100. 0800 399 100. It's a toll-free line, and people can call and they will get to speak to a palliative care specialist, somebody who knows about palliative care and can refer to them. In most cases, for the calls we receive, they will tell them to reach out to the health facility that is close. But we also run a database of all trained palliative care providers in the districts. So we will maybe most likely link you up to the palliative care provider that is close to you if when you call we find that what you are talking about is a palliative care need or issue.
Okay.
Yeah.
There is also an office line and a WhatsApp number, just in case someone doesn't want to call. And when you let me, I will read out these two numbers. So the WhatsApp number is 0789 7377 86. 0789 7377 86. Now this is a WhatsApp number. You can send in you can send your question or your inquiry in form of a WhatsApp, but the office line is 0392 080713 0392 080713. Now those are the contacts through which you can reach out to PCAU Secretariat, but you can as well share with us your website so that if someone wants maybe to follow up on what you do and what you work on, and also read about that strategic plan, where they can find it.
Yeah, thank you so much, Mukalazi. Our organization is the Palliative Care Association of Uganda. If you are using any Google gadget, iPad, phone, computers, and you type in there, it will give you pcau.org, which is our website. And then we have listed our programs there, but also further contact, and also the website will prompt you to send a message to us, and we will gladly receive it. And thank you so much for even reading out the WhatsApp numbers. And we, like I told you, we are in regions and in districts. It's most likely that once you go to a health facility and ask about PCAU, some people will know. But for me, what I encourage you is that the issue that you have is addressed. So go to the nearest health facility. Unless you are challenged, then call the numbers that we have given you. We'll do our best to connect you, to make sure that we reach you and the health facility can reach you.
Mark would really want to stay here for longer than this if it wasn't the time that is a little limited. And now that it's running out, what would be your last remark as we are winding up this discussion in a minute?
Thank you so much, Kalazi, and I'm grateful to the Family TV for hosting us this evening. Palliative care is everyone's business. The approach of palliative care starts at the point when someone is diagnosed with a condition or with a disease that really needs you to move this journey of treatment and of adhering to treatment with colleagues and with a team that is compassionate, that is looking at you as a person, not necessarily concentrating on the disease or condition that you face. Now, my last word is to everybody. Now, especially to people who make policy, who are watching us this evening, at whatever level you are, there is something that you can do to reduce the pain and suffering that is permeating our community. We are talking about at least 500,000 people in our community who face life-limiting illnesses, who would benefit to this care if they were into the care. The number of service providers are still few because the resources are limited. There is something that everybody can do. Very lastly, we have been talking about the 4th Uganda Conference on Cancer and Palliative Care. The conference is coming to us on the 14th and 15th of the month of September. The conference is at Speak Resort Munyonyo. We are appealing to all of you to look out the website of PCAU, to look out for the conference information, to come and learn and be part of this conference. For the health workers, we really encourage you to make sure that you apply and register to attend. For members of the community, to continue following and to listening to us. For the rest of the cadres I spoke to, the lawyers, the social workers, the people who have done community psychology or psychologists, please look out and let's come together and converge for the 4th time together to talk about palliative care and the science and the data and the information that we have to relay and share experiences and network with people who are in the country and those who are coming in from across the globe. I thank you so much.
We thank you too as Church of Uganda Family TV. Thank you so much for choosing Church of Uganda Family TV. And when we talk about palliative care, one thing I want to remind you this evening, that you're not alone. You too can smile. God bless you. We meet again next time.